Hello everyone. I hope everyone's doing well tonight. Tonight's session is going to cover decision making when conducting a research study. Now, since we're getting close to our dissertation, we must focus on how we're going to conduct research and reviewing literature that has been posted in previous situations and associate that with what we're doing today to complete our dissertation. So, our main focus tonight is going to be making a decision on how we're going to conduct research as we move toward our dissertation and move into our dissertation. All right, and the first question you may ask is, why is a literature review necessary? Well, it's necessary because we need to conduct research to uncover information that has been previously published to determine if it is even worth us digging deeper into a specific subject. So, in order to come up with a conclusion on that, we must do research. We must study previous literature. Now, the purpose of this review is to survey a specific topic of interest. Now, this process helps to gain access to information regarding needed resources to complete what we're setting out to complete, a specific study on a specific topic. Now, we must critically analyze any literature that we come in contact with, that we research, that we study, to target the specific content that we're looking for. Now, by clinically analyzing a topic, we become better informed on decisions that we want to reach by weighing in on competing points of view, because we're trying to establish our own point of view in our studies and in creating our dissertation. Now, as part of this process, we must synthesize all of the information that we obtain that contains specific topics of our specific study. And completing this step will help us to review and forge a connection of all of the information, past, present, and potentially future, on the topics of study. Now, in order to help us do this, we have to build a strong foundation. And our foundation is based on theory. So we have to create and establish a theoretical framework for our dissertation. Now, in this process of designing an academic dissertation, we're trying to again establish a foundation. And if you know the basics of a foundation, the foundation must be strong enough to hold up anything that you add to it. So this theoretical framework is providing us with that foundation. Now, this foundation, also referred to as a theoretical framework, helps us to methodically interpret any information that we encounter, that we obtain through our research and study. Now, as we research and review content, we must associate it with both independent variables as well as dependent variables. Now, for my dissertation, my plan is to associate my study and research, creating my theoretical framework, by utilizing two independent variables, specifically that of licensed paramedics, paramedics that have received their certification and added to that certification additional study to get a degree in that specific discipline of study. I'm going to add to that independent variable a close counterpart in healthcare known as a registered nurse. Now, for years, these two disciplines of healthcare have been in somewhat of a competition trying to either establish equity in what we do, because our goal is the same, a favorable outcome for the patients that we encounter. But nurses tend to have a higher level of status and higher compensation because of their standing in the health care community. Now, nurses typically do what they do in a clinical setting, whereas paramedics do what they do, their practice, in the field. Now, again, both disciplines in healthcare are focusing on a common outcome, and that's the best outcome for the patient. So, my independent variables, again, is licensed paramedic and registered nurse. So let's go a little bit further. Now, my independent variable is the scope of practice, the practice that is expected of each discipline in their environment of practice, and covering the things that they are responsible for doing based on their certification, their license, their ability to practice. Now, each of the healthcare practitioners, their discipline requires oversight by a licensed physician. Now, the paramedics, again, they work in the field environment, out of the hospital environment. Now, because they are not in a clinic to where you typically find doctors that can directly oversee operations, paramedics are expected to carry out their duties under assigned protocols, and because they're not in the clinical settings where doctors typically are, paramedics are expected to have a higher degree of autonomy in practicing their skills under that authorization to practice, which is under a licensed physician. Now, paramedics typically operate away from the clinical setting, i.e. hospitals and clinics, requiring a greater degree of autonomy in practicing the skills and treatment that we're expected to cover. Now, field practitioners such as paramedics are typically under protocol-driven guidelines, which means that a licensed physician outlines what they will allow us to do as non-physicians in their absence. Now, on the other hand, nurses typically operate in the clinical setting, typically where you have physicians. So, since they're in the same environment of physicians, they are granted less autonomy, and their operations, their practice, are directly driven by a physician. So it's physician-led orders that grants them the ability to practice medicine as a non-physician. Now again, both of these disciplines are working for the greatest outcome of the patient in performing the tasks in which they're trained and skilled to do. But paramedics typically make quite a bit less than, financially or in compensation, than nurses, even though we're doing similar things, just in different environments. Now, my research and study is to delve further into why that is happening and maybe come up with a consensus, a general consensus, to bring us closer to parity in status and compensation. Now, formulation of research requires us to establish questions that will help drive our end result to an understanding by all interested parties. Now, to formulate a substantive research question, extensive content-based research and studies must be targeted toward the required topics. All right? So this is going to require reviewing past and current literature to establish whether there are any unsolved problems in the research based on this information or this target, or unexplored methodologies. Now, based on any discovered information, determine if there are any missing elements and what type of gaps were created as a result of that. Now, with all of this, we want to formulate questions based on these findings using open-ended questions requiring lengthy discussion, guided by why things are the way they are, and how can we change it to come to the intended results. Now, again, we're formulating questions with the why and how to target the specific variables that have been identified. Okay? Now, in summary here, the purpose of this research is to uncover information on specific topics to form a strong foundational framework to formulate subsequent literature to make a case on why and how we can come to a general consensus on parity in status as well as parity in compensation. That's our lecture for tonight. I hope everyone enjoyed the lecture. Are there any questions? I'm open for questions at this time. If no questions, have a great night and good luck in your studies.